Hello, my name is Mark Adahar. I'm one of the surgeons of Precision Surgical Group, and you have been diagnosed as having acute appendicitis. Um, Now, before I start this video, all the information presented in this video is 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 pertinent only to myself and my group. If you're having surgery somewhere else, then what your surgeon may choose to do may be different than the information presented here. So that's my disclaimer. So, you have been diagnosed with having acute appendicitis. Now what? Let me guess, you probably started having abdominal pain, the stomach pain didn't go away, it kept getting worse and worse. Then you went to the emergency room because it wasn't going away. They probably did a CT scan and they showed that you had appendicitis and now you need surgery. That being said, either myself or one of my partners is about to take care of you very shortly. But in the meantime, I want to explain what's going on and what's probably going to happen to you. All right? So, you have acute appendicitis. Acute appendicitis is an infection of your appendix. Your appendix is part of your large intestine, which is right here, and this is your large intestine. And what happened is a little opening that goes into your large intestine likely got clogged with a piece of stool or something like that. And when it gets clogged, all the bacteria build up inside the appendix and causes an infection and the pain you're probably experiencing. Now, the appendix really doesn't have any significant function nowadays. You can, once we remove it, your life won't change at all except for the incisions from the surgery, but you won't have to be on any special type of diet. You won't have to adjust your lifestyle at all. Now, that being said, you will need surgery to remove your appendix because if you don't, your appendix can rupture because of the buildup of this bacteria on the inside. And if it ruptures, that becomes a horror show, which you probably don't want to experience. So, the surgery for appendicitis, it's what we call laparoscopic appendectomy, which basically says we use cameras to take out the appendix. The traditional way is an open appendectomy, which is still good, but it requires a cut about, depending upon your size, it cut about this big. We make a cut in the right lower side where you're having the pain. You have to cut the skin, you have to go through the muscle, and then we pull out your appendix through the cut and we remove it that way. I don't like to do it that way because I feel that your pain is more and your recovery is longer. But some surgeons choose to do it that way still. However, myself and my partners do it laparoscopically, which means cameras. So this is how it's going to work. You probably already have an IV in you right now, and you're getting, if you haven't already, you will be getting a dose of antibiotics. When it comes time for surgery, you will go into the preoperative holding area, and that's when the anesthesiologist will talk to you, and that's when myself or one of my partners will talk to you. After we talk to you and make sure you have no further questions or any other issues, we'll roll you to the operating room. The anesthesiologist is going to give you a medicine through your IV to make you very sleepy and start forgetting everything. Once we get you into the operating room, that's where you're put completely asleep. A machine will temporarily breathe for you during the duration of the procedure, which should take somewhere depending upon how severe your appendicitis is, it usually takes somewhere around between 20 or 30 minutes to perform the surgery. But once you're fully asleep, we uncover your abdominal part from your pubic bone to about just below your breastbone, and we shave off any hair in the area. Then we paint your abdominal wall with chemical that kills all surface bacteria. Once that's done, we make an incision, usually either right below your belly button or just above the belly button, and we make a cut through the skin, and we have to make a small cut in the muscle. This cut's about 1 inch. And then once we make that cut in the muscle, we fill your stomach, or your abdominal cavity I should say, with carbon dioxide. we make you look like a big beach ball. And the reason why we do that is because it creates a space for us to insert the other instruments to take out your appendix. The reason why we use carbon dioxide is because after the surgery it gets absorbed very quickly, it goes away. So once we make that cut, we put the gas in, make you look like a beach ball, we make 2 other 5mm cuts. One usually right above your pelvic bone on the bottom in the middle, and one right in between it. Sometimes we do maybe make a small cut on the left side. And then through these smaller cuts, we put in smaller, longer instruments to find your appendix. And basically what we do is we lift your appendix straight up and down. We find the blood supply to the appendix, and we cut the blood supply using a special type of energy device, or sometimes we use clip appliers. And then once we do that, we basically, the appendix looks kind of like my finger. We basically have a special instrument like a stapler, and we just cut it off at the base, take the appendix, put it in a bag, and remove it from your belly button. Once that's done, we look around, make sure there's no other areas of bleeding or infection. We might want to wash it. We might wash it out with some sterile water. And then after that's done, we remove all the cameras, remove all the instruments. We close all the holes with stitches that dissolve, or sometimes we use skin staples, which we remove in 10 to 14 days. Wake you up from the anesthesia, and then send you off to the recovery room, where you wake up, and then you go to your room. Then after you go to your room, we have to make sure you can eat okay, and that your pain is well controlled. And depending upon how you do, you go home, either later that same day or usually the next day. Basically, that's a procedure. Now afterwards, you do have some limitations. You do have fresh cuts. You do have fresh cuts that take time to heal. So you will have to or refrain from any strenuous physical activity for at least 2 weeks until you see us in the office. But you can eat like normal. You should be walking around, because the more you walk, the faster you get better. You can drive just as long as you're not on your pain medication, because the pain medication may mess up your head a little bit. And but other than that, you really don't have too many restrictions, except for being not too physical. And I think basically that's about it. You'll be seeing us shortly, so if you have any questions that wasn't covered on this video, you can ask us at that time. And we'll see you soon. Good luck.